Today I am going to discuss screening in the pregnancy. What is screening? Why screening has to be done in the pregnancy? What are the different screening tests we have in the pregnancy? What are the different screening models we have? And what are its benefits? What is screening? Screening is it identifies the patients at risk of having the disorder in an unsuspected population. It filters the patients for further diagnostic testing. And why screening has to be done? Why aneuploidy screening has to be done? What is aneuploidy? Aneuploidy is numerical errors in the chromosome. That is, either having one extra chromosome or missing chromosome is called as aneuploidy. Why aneuploidy screening is important in the pregnancy? As the prevalence of the autosomal trisomies is more common in the pregnancy, like Down syndrome, trisomy 21, the prevalence is 1 in 800 live births, trisomy 13, 1 in 16,000 live births, and trisomy 18, 1 in 5,000 live births. So, aneuploidy screening has to be done in the pregnancy. What is the correct time to do this aneuploidy screening? In the first trimester, we have to do this at 11 to 13 weeks, 6 days of gestational age, which we call it as a combined test. In the combined test, along with the NT scan, we do the double marker test. In the double marker test, we do the beta HCG and PAPA values. Pregnancy associated plasma protein A levels are checked in the double marker test at 11 to 13 weeks, 6 days of gestational age. After doing this test, we classify these patients into high risk, intermediate risk and low risk. The patients who fall into the high risk group are offered NIPT, non-invasive prenatal screening test, or cell-free fetal DNA based on the patient's opinion. The patients who fall into the intermediate risk are offered cell-free fetal DNA testing or NIPT and or quadruple screening test. The patients who fall into the low risk, no further testing is offered. What is the detection rate of this test? It is around 85 to 95% with a false positive rate of 5%. And coming to the second trimester, we have the quadruple screening test. The quadruple screening test is done at ideal time is 16 to 18 weeks of gestational age, and the BPD measurement should be 33 to 52 mm. In this quadruple screening test, we check for the alpha fetoprotein, beta HCG, urinary estriol, and inhibin A. What is the detection rate? It is around 70 to 75% with a false positive rate of 5%. Newer advanced test is a non-invasive prenatal screening test. This non-invasive prenatal screening test, it is a screening test. It should be done greater than 10 weeks of gestational age. It detects the cell-free fetal DNA in the maternal circulation. And what are the advantages of this test and what are the indications and contraindications? The indications of this test are we have to do in the cases of advanced maternal age, and if the patient is high risk in the double marker test or any other screening test, we can go for this non-invasive prenatal screening test. It should be done greater than 10 weeks of gestational age. On the ultrasound, if we detect any soft markers, we can go for this test. What are the contraindications? In the cases of higher order multiple gestations such as triplets, less than 10 weeks of gestational age, vanishing twins, we should not do, and in the cases of structural anomalies. What is the detection rate of this test? Detection rate of this test is, it is done usually for the common autosomal trisomies and sex chromosomal aneuploidies. For the trisomy 21, detection rate is 99.7%, and for trisomy 18, it is like 97%. For trisomy 13, it is 99%. We have to do the baseline scan before doing this non-invasive prenatal screening test. What are the advantages? The advantages are increased detection rate and decreased false positive rate and decreased number of invasive procedures. So, screening tests are important in the pregnancy and it should be done at the right time. That is, a combined screening test should be done at 11 to 13 weeks, 6 days of gestational age. Quadruple screening should be done. Ideal time is 16 to 18 weeks of gestational age, and the non-invasive prenatal screening test, which is an advanced test, can be done greater than 10 weeks of gestational age. But the ideal time, it should be done before anomaly scan so that we can act upon the results. Thank you.